Hello, Gary Crowley here with DoItYourselfJointPainRelief.com. This is video 4 of 4 videos for sciatica pain relief. And in video 1, we showed you how to stretch all these big strong muscles in your hips, and we made sure we did both sides, since both sides are probably playing a role in your sciatica. In video 2, we showed you how to release those same big strong muscles in your hips, but in a really fine-tuned way with various balls, depending on the table and the size of your butt. Different balls work better for different people. But so now that we got those hips released, we then showed you how to release these big strong hamstring muscles that can yank on your pelvis and cause the tension in your hips, and so you feel that sciatica. And now in video 4, we're going to show you how to release this big, strong outer quad muscle called your vastus lateralis, your IT band that a lot of people have heard of, since these can basically torque on your pelvis and torque on your femur in a way that'll cause your pelvis to have to adapt and tighten. And then we're going to release this little muscle way up here called your tensor fasciae latae, that is the muscle that attaches to the tendon that is your IT band. So basically, on my website, again, I show you how to do all these techniques, but we're going to come at this outer third of your quad, and we're mostly going to do a press, pull, release. And the press, pull, release, and again, if you go to my website, the techniques page, I show you in about a minute how to do all these really, really well. You're pressing on the tissue, you're pulling it, and then you're releasing. You are not massaging the tissue. Massaging it does not really... it does other good stuff, but it doesn't tell your brain, I want this to release. So I'm pressing, pulling, releasing, and then I'm taking this other hand and I'm pressing on my fingertips so I can get a lot of good pressure there. It doesn't take much, so that even if you're not that strong, by adding this other hand, pressing on those fingertips, you get a fair bit of pressure. And you press as much as you can relax into, and when you find a painful, tender spot, you press, pull, release, press, pull, release, press, pull, release, press, pull, release, and there, that lets go. And then you go find another tender spot. Press, pull, release, press, pull, release, press, pull, release. And that lets go. And again, I am not massaging it. I'm grabbing a tight spot and I'm stretching it like it's clay or saran wrap. I'm grabbing it and I'm stretching it and I'm grabbing it and I'm stretching it. And that gets your brain the message to release that. Your cerebellum says, oh, he's pressing on all those little springs, those little sensors called Golgi tendon organs in my tissue. And he must want that tissue released. So you investigate. Healthy tissue isn't tender when you press on it, isn't painful, so you skip all the spots that aren't painful, and when you find a good tender spot, you press, pull, release, press, pull, release, press, pull, release, and that's what you do on that whole outer third of your quad. Take your time, do it a little bit at a time. If your hands get tired, you can switch, or you can take a break and come back in a half hour and do it again. Same thing with your IT band. Now on the very side of your leg, now on my quad I was up here. Here I'm kind of coming in from the side and grabbing that. But I'm pressing on those fingertips with my other hand, and you'd be amazed. Then this hand doesn't have to work as hard. It can be worried about being precise and staying on that tender spot. And then this hand can just apply all the pressure. You can even use your body weight a little bit. And just press, pull, release, press, pull, release, press, pull, release. And you just do that all the way up your IT band. Now some people like to roll on those rollers to try and release this stuff. And, my joke is, well, those rollers don't do too much, but at least it hurts a lot. I personally don't find them that effective. I haven't found them that effective for my clients. I find a much better use of your time is to take your fingertips, find a tender spot, press, pull, release, press, pull, release, press, pull, release, press, pull, release. That's, now if you want to do press, pull, press, hold, move, like I show you in the way, you can do a little bit of that. I do find press, pull, release works a little better on this part of the body, but a press, hold, move where you press on the tender spot, hold it, and make that muscle function, you can do that too. So that's for those two muscles, and again, they yank on your pelvis, kind of torque it sideways when they're tight, and cause everything else to tighten a little bit to adapt to it. Now lastly, I want you to release your tensor fasciae latae. I'm going to take my belt off, but if you see that right where my nickel is on my belt, that's basically where your tensor fasciae latae is. There's my hip bone, there's the head of my femur, my leg bone, And right in between there is your tensor fasciae latae. So I'm going to take my belt off, and all you want to do is take a ball, a suitable ball, either a tennis ball or, that's probably about right, but let's see. You're going to find that, you can find it before you lay down, and you just lay on it. Now that's pressing into my tensor fasciae latae a little bit, and I'm going to do the technique where it's basically a press hold move, but I call it the tennis ball technique on my site. But basically, that ball is pressing on one spot. It's not moving, and I'm making that muscle move a little bit. Now the tennis ball actually, unfortunately, for this amount of cushion and my body, it doesn't really do much. It's not applying enough pressure. So I need a little bigger ball. But like I bet this ball that I think is comes out of a pitching machine. I bet this one's too much. I bet this one, yeah, see that hurts too much. Honestly, I can't relax into that, and I know that just from there. Now this is a kid's soft little baseball. And that's perfect. That fits, that presses right there on that tender spot. And I can relax into it. It's just perfect. It applies the kind of the maximum amount of pressure I can relax into. And let's see, let's get that to release. And I'm just playing with that. There it goes. There it goes. So again, you just need to apply the pressure, make that tissue move. And actually that feels good. I don't want to actually stop doing that, but I will to keep the video short. And okay, so release this, release this, release this. Do both sides of your body since everything's yanking on everything else. So let's see, video 1, we stretched all these big hip muscles right here. Video 2, we got in there with balls of various types and sizes to release them. Video 3, we released this hamstring with a softball and a great stretch that you can't do too much. Video 4, we released your vastus lateralis, we released your IT band, we released your tensor fasciae latae. So now, assess both how much better it is just from since you did this last video, and then I want you to kind of go back to where you started and assess how much improvement you have from video 1 till now. Notice where you were still tight, maybe could use a little more work. Notice where you got the most relief, maybe do a little more work there. And generally feel free to watch these videos again and follow along. And I look forward to hearing how it goes. I thank you for your time, and I do sincerely hope these videos helped.